I'm Gaston Baslet, and thank you very much for this invitation. Both Dr. Bennett and I are really appreciative of the opportunity to speak with you tonight. I want to say I'm a clinical neuropsychiatrist, and I consider working with patient advocacy groups in the United States, at least in Boston, in the area where I work. It's called the Epilepsy Foundation. And I really consider the Epilepsy Foundation a partner in the care of our patients. So thank you for all the work that you do for everyone with epilepsy and related seizure conditions. So Dr. Bennett and I will talk about the challenge of managing anxiety in epilepsy. And neither Dr. Bennett nor I have any conflict of interest related to this talk to disclose. So let me start by saying that experiences with anxiety are just human experiences. I'm sure if I ask, anyone in this room to raise your hand if you never had any experience with anxiety, no one will raise it because it's a human experience. We all have had experiences where we had felt anxious. So these experiences can range significantly, and of course people with epilepsy will experience anxiety as well. Anxiety can be a very adaptive response. It can actually help us prevent or prepare for future events. So it can be very adaptive. But also anxiety can go overboard, and anxiety can actually become disabling if it really becomes very significant and it becomes a problem in someone's life. When we talk about anxiety in the context of epilepsy, we know that patients with epilepsy do experience significant proportion of disabling or significant anxiety symptoms. There are studies supporting this and showing that more than a quarter of patients with epilepsy suffer from some form of anxiety disorder, which is significantly higher than in the general population. Now, anxiety may appear before even the first seizure happened, or it may appear after the first seizure. And we'll talk about that, and I'll talk about that when we talk about some of the shared biological risk factors for anxiety. Now, the experience of anxiety can present very different from person to person, and I think that it's better to hear directly from patients that have these experiences. So we are going to show you a video that we are playing with the permission of Young Epilepsy that shows you different young people with epilepsy, adolescents and young adults, and they talk about their experience with anxiety.
It's going to come, because I have the answer in my head.
Is the answer to that not anxious? I used to be really embarrassed.
It was a real powerlessness that I felt.
It was very scary.
I felt really anxious because I didn't know what was going to happen.
When you have epilepsy, anxiety just kind of comes part and parcel with it, really, because you constantly have to reassess your life as it goes on.
When you're walking down the street, there is that risk that you can just keel over and have a seizure. It's stuff you don't think about. Like, since that seizure, I've not had a bath. Whenever I have a shower.
Often, seizures would come out of nowhere. You never know what's going to happen or when it's going to happen and how bad that's going to affect your day or your life.
It made me not want to go out. I just didn't know how to move that feeling away, and it was a really new feeling. Anxiety was something I haven't felt before.
I think I used to be really embarrassed, and it would make me nervous if people were to see me with my arms just suddenly flying up in the air. Even like on a daily basis, you have to plan ahead, plan your journey, assess your safety, decide if you need to tell the people that you're with you have epilepsy or not.
I've had real life incidents where this has become a problem. I used to teach public speaking at university, and I was sort of teaching my group of students, and I had what I would call an absent seizure. And when that sort of seizure happens, that anxiety, that could happen again, really is just there throughout your whole life.
It makes me more worried to go out and about by myself, and it makes me feel bad for the people around me, because obviously I'm stressed that they're going to be stressed, and I don't want to impact them too much.
Travelling by myself, to training, to wherever I needed to go, that really overwhelmed me, and I felt really anxious because I didn't know what was going to happen if I was going to have a seizure.
So as you heard, the experience with anxiety can take many shapes and forms depending on the person. So in our clinical work, we feel that addressing anxiety is obviously very important, not only because it will help address the distressing experience of the anxiety itself, which is a reason in and by itself to diagnose and address any anxiety disorder, but also because it has implications in the care of epilepsy. We know from research that having significant anxiety can affect seizure control. We know that anxiety can also have a negative effect on cognition, on suicidal behaviors and mood. It can also affect how much someone can tolerate an anti-seizure medication and how effective an anti-seizure medication can be. And of course, it can impact quality of life. So when we're talking about addressing anxiety, we're really not talking just about the subjective distressing experience, but a much larger picture that can affect someone's life. Now, we know that anxiety is common in people with epilepsy, and we want to understand why, and that's one of the main ways that we can get then to the appropriate treatments. When we think about anxiety and epilepsy, there's no one answer that we can say it's because of X or Y or Z. It's usually a combination of factors, and we like to think about biological, psychological, and social factors. So in terms of, for instance, biological factors, we know that the electrical activity of epilepsy can, over time, create vulnerability in certain parts of the brain that can be responsible for the expression of anxiety. We know that certain medications used for epilepsy can cause more anxiety, or sometimes it can actually alleviate anxiety. It depends. And we also know there are chemical changes in the brain that actually are shared between epilepsy and anxiety and may explain why there's so much overlap. So there are several explanations why people with epilepsy are more prone to experience significant anxiety. But there are also other explanations. Psychological explanations, psychological factors play a role. How each person is processing the experience of a seizure, how that triggers a lot of worrying, how that may trigger a lot of physical tension and anxiety, and that keeps being fed over time. And that is actually another avenue for intervention. How the brain is processing the experience can definitely contribute to the experience of anxiety. And also, of course, we need to take into account the social context. People do not exist in a vacuum. We exist in a world, and how the world responds to us can also facilitate the expression of different symptoms, in this case, anxiety. We know that people from epilepsy, unfortunately, still experience stigma or discrimination, difficulties in school, and all that contributes to the experience of anxiety. So when we're thinking about anxiety, we need to think about addressing all these different factors. Now, in an ideal world, all clinicians that will evaluate and treat epilepsy will screen and as carefully assess and treat anxiety. And actually, Dr. Bennett and I are part of a larger task force to integrate mental health care into the care in epilepsy. Until that becomes routine for everyone, it is always helpful for patients and families to know how to communicate with doctors when there is some suspicion about epilepsy. So I'm going to share with you important information that could be helpful for your doctor to know if you experience anxiety. If you want to share that, what are the kind of information that they will want to hear from you? Usually what we want to hear as clinicians, we want to know the kind of symptoms that you have. Do you worry a lot? Do you have episodes of panic, a lot of fear that something bad will happen? Do you tend to avoid things because of that fear? That's important for us to know. We also want to know how often you experience these symptoms. Is this worry always in the back of your mind or only happens sometimes? That's important for clinicians to know. Also, we want to understand when the anxiety started. Are there medications that, when they were started, made your anxiety worse, or actually medications that help your anxiety, or other life events that contributed to your anxiety? Does anxiety only appear right before and after a seizure, or it can happen at any time, or both? That will change significantly the approach that we take. And also we want to understand if you ever received any treatment for anxiety and how helpful it was or not. So, of course, it's not your job to know all these answers, but this can be a reminder for you to make it easier when you have these conversations with your doctors about anxiety. Doctors will want to hear from you a lot of this information to help guide further assessment and treatment. Another goal is to... I'm sorry? Memory loss? Yeah, of course we want to assess that as well. I mean, we're talking about anxiety, but of course memory loss and mood. In terms of, we also, we're in a clinical setting, one way for us to pick up anxiety and help guide further assessment and treatment, we use sometimes screening tools. And some of you may be aware with these screening tools for anxiety. One is called the GAD-7, Generalized Anxiety Disorder 7, and the other the EASY and the BRISI. The EASY is the Epilepsy Anxiety Survey Instrument, and the BRISI the brief version of it. The reason why I'm bringing this up, some of you may have filled this up in clinic, but these are in the public domain. You may even find these online. And the reason why I'm bringing them up is even looking at these questions and answering these questions may trigger you or help you think about whether, this may be a conversation worth having with your doctor that can then help guide more assessment and treatment. So again, one of the goals in the care of epilepsy is to integrate this as routinely as we can in your epilepsy care. Now I'm gonna have now Dr. Bennett, who will talk about treatment of anxiety disorders in epilepsy.
Thank you. So what do we do when we find out that there is anxiety at a level that's causing impact on our lives? So what is good news, we think, is that they're really effective and safe treatments for anxiety disorders. And there's evidence that those also work in people who have epilepsy. So this is the guidance that's from the UK National Institute of Health and Care Excellence, but there are other international guidance for anxiety disorders. But they're all fairly similar. So in terms of evidence-based treatments, they're mainly in two categories, so psychotherapy and medication. In terms of psychotherapy, self-help resources have got a really good evidence base, so that might be books or online programs, and they can be delivered either directly without any therapist contact or can be facilitated by a therapist. Can also have support and psychoeducation groups, and that just means basically learning about anxiety and epilepsy. Psychotherapy, the main evidence-based treatment is cognitive behaviour therapy, and I'm going to be talking more about that in the next slide. Medication, we've got a slide on that I'm going to talk about because of time, but Gaston is the expert on medication as the psychiatrist, and also a combination of psychotherapy and medication. So cognitive behaviour therapy. That is the main evidence-based psychotherapy for anxiety disorders generally, including in epilepsy. And it's based on the idea that our thoughts and our feelings and our behaviours are linked together. I'm now going to show you a video. This comes from YouTube, and I'm a child and young person psychologist, and we do a lot of finding YouTube videos in our therapy. The young people like this one, and I quite like it because it explains CBT in a pretty straightforward way.
Miss Erin Doctor presents How to Treat Anxiety with Exposure and Response Prevention. Have you ever heard of this? Exposure and Response Prevention, or ERP? It's something we use to make anxiety smaller. I wish they named it something else, though. Exposure and Response Prevention makes it sound so scary, but it's not really. It's actually something you already know about. You know how getting into a cold pool is difficult at first? So you sort of move in slowly and get used to it as you go? That is a lot like exposure and response prevention. As we get used to something, it becomes no big deal. Let me show you how it works. Let's say you are afraid of dogs. First, we make a list of all kinds of activities involving dogs, and we put them in order from the least to the most scary. Then, you go and do that first thing on the list. Looks like we're going for a walk in the park. So what we are doing is exposing you to dogs and preventing you from having your usual response, which would probably be to run away, right? When you do this in small doses, you get used to it as you go along, just like the pool. As you conquer each step, it will no longer have power over you, and it will give you the strength for the next step. Some people think that exposure, all by itself, makes fears and anxiety smaller. And that's true. But I like to encourage people to use some coping skills along with it. Could I have a whiteboard, please? Thank you. I suggest using positive self-talk to coach yourself through. You can tell yourself that you are perfectly safe and everything is okay. You may even need to use a relaxation technique, such as alternate nostril breathing. When you use all these tools together, you have some powerful stuff working for you.
So that might make it seem like it's pretty straightforward, but we know that when people have epilepsy, they may have specific fears like dog phobia, and that's actually very common in the children and young people that we work with, because there are different kinds of anxiety problems. But people sometimes are anxious about having seizures, like in that young epilepsy video. The techniques we use are still the same though, so that exposure and response prevention. What we're thinking about is the impact of the anxiety about having seizures on everyday life. So one of those young people said that they weren't going out at all because they were worried about having a seizure. So you might help practice with them going out, maybe just going down the street, then maybe 2 streets away, then being able to go on public transport, for example. Sometimes you might need to think with a doctor about what's safe, though, as well, and come up with some problem-solving, some strategies around making sure that we can do those activities safely when people also have seizures. That's the main evidence-based psychological therapy, and we also wanted to talk a bit about medication. So the important points are that most medications for anxiety disorders are safe to use in epilepsy as well. The options for medication might be to change the medication to help your anxiety, so altering the medication that you're taking for seizures to support the anxiety, but important also not to cause more seizures when doing that. And secondly, to add a medication that's specifically for anxiety, but again, making sure that it won't interfere with your existing medications, and that's really something to talk about with your neurologist or psychiatrist, and Gaston will be able to answer more questions about that. So our take-home messages. We know that anxiety disorders are common in people generally, but particularly in people with epilepsy, and can impact lots of aspects of their lives. But being able to discuss those experiences with a doctor can help to expedite diagnosis and access to treatment. So getting treatment as early as possible for those anxiety problems. And the good news is that there are effective and safe treatments for anxiety disorders in epilepsy. Thank you.
Thanks very much. I hadn't even started to enter the stage area. So well done on your timekeeping. And a couple of questions came in, which I'm not sure will be something that you can really answer, but I'm going to put it up to you here now. And so whichever of you want to answer it. Is there any advice in differentiating general anxiety from anxiety that's induced by anti-seizure medication? Keppra was named, but that's just one to mention. And also, more importantly, about anxiety caused by frontal lobe seizures.
Do you want to take those?
That's a lot, yeah.
Yeah, so in terms of the question about the different syndromes, so when we are assessing anxiety in clinic, we want to understand what specific anxiety syndrome it fits into. There are different syndromes that we think about when we think about anxiety disorders. Generalized anxiety disorder is one, it's the most common one where people tend to worry a lot. They have a lot of worries that they cannot basically, take away from their mind. That's a very common anxiety disorder in the general population and in people with anxiety. But it's one type. Other people have other types of anxiety disorders. And really, the best way to diagnose that, we have some screening tools, as I show you, but it's really to get a very good clinical history. And that's why I kind of gave you some prompts on, the information to give to your doctor is, the kind of symptom that you have that will help guide, other questions. But, the other question was about medication, and sometimes anti-seizure medications can induce or make anxiety worse. Maybe a pre-existing anxiety that gets worse, or maybe there was no significant anxiety before, and now anxiety gets very disabling or very significant after the exposure of medication. And how we're going to be able to tell that is really also taking a good history and knowing chronologically when the anxiety started. In an ideal world, if you take measures, during your different clinical visits, we may be able to see how after a certain medication was started, whether there was an increase in anxiety after a specific medication was started. There are some anti-seizure medications that are more prone to be anxiety. Levetiracetam, which was named, Keppra is the trade name, is notorious for causing more psychiatric side effects, including anxiety, but also depression. There are other anti-seizure medications that actually tend to be more benign, actually could be beneficial for anxiety. For instance, pregabalin or gabapentin. So, basically that is a discussion to have with your neurologist, depending on the regimen that you're on and what medication will be the best fit if anxiety is really problematic.
Thanks very much. And another question, is CBT okay for everybody in the population, or is there certain groups of people that it potentially may not help with or support them with? Yeah.
So we have just done a trial, and the results are not published yet, but hopefully will be soon, looking at CBT for children and young people with anxiety, depression, and behaviour problems. And in that trial, we basically took any child that was over the age of 3, between the age of 3 and 18, that had symptoms of anxiety, low mood, and behaviour problems. So we included children who had diagnoses of ADHD, autism, and children who had intellectual disability. And the results are showing that all of those groups did just as well with the CBT. So there's no evidence from that there are any groups that shouldn't be able to access this kind of treatment.
Thanks very much. And you just actually answered the final question also in that, so thanks very much. So I just want to thank you both for your really interesting talk on something that we don't usually talk about as openly, and I think it's great to have yourselves, who are the leading experts in this area.